act will help us to put some things in place. And delay will further continue to delay the progress we want to make in the health sector in Nigeria.
Professor Jerry, you talked about flow process amongst the three levels of care in the hospital system. What he's saying here points to structure.
That's correct.
And he's talked about implementing that national health law.
Yes.
I'm sure you would have had an opportunity to look into it a bit. Let's just talk about it a bit. How do you think it would be effective in creating the kind of structure you've talked about?
Yes, it will be effective if you apply the laws or the principles of the Act. Local government is funded, and they do have specific financial funding for health sector. But does this go to the primary health care centers? Does it go to buying drugs? Perhaps not. And why do we get away with that? Is because nobody is being held accountable.
But this wasn't the situation before. I mean, there was a time when we had the healthcare centers, we had the maternities growing up.
We still have them. It's how functional.
That's the word. Functional healthcare centers and maternities. I was born in a maternity, and it's still standing there. But the last time I passed in that,
it's empty.
I wasn't born in a
You don't want to describe it.
I don't want to. And behind that maternity, there was a kind of like quarters built around for the nurses and those working in the maternity. How did we get to this point? And do you think we can get back there again?
I think people believe that to be treated, you have to go to the best center, a teaching hospital. And that's not correct. For basic illnesses that can be addressed in primary health care level. Now, primary health care, rural areas, staff don't want to go there. Doctors don't want to go there. Nurses don't want to go there. One, the infrastructure, the housing, light isn't available. And to attract people to go to such areas, there has to be some remuneration, some reward. I don't expect every primary health center in Nigeria to be staffed by a doctor. We have to look at our own model, similar to the midwifery scheme level, where we train healthcare workers, they don't have to be nurses or doctors, to treat simple things as diarrhea, malaria, anemia in pregnancy can be treated by somebody who's been trained. It could be a 1-year certification or diploma. But to expect that you will get doctors in every primary healthcare center is not going to be possible. It's going to be a waste of expensive resources.
Now, let's look at the funding for the health sector. If we look into the National Health Act, we see that there's a bit of, the portion of it where we talk about funding, taking perhaps I think 1 or 2% of the consolidated revenue fund, so that, funding is improved. The WHO says 15% of the budget. I don't know, we're doing around 5, 6, 7% or thereabout. We have a new administration. If you are the Minister of Health, or you have the opportunity to talk with the President, how do you think they can go around making sure that there's enough funding and Nigeria is not dependent on donors for almost everything that we need to do?
Well, what you said is that we need to know what we are budgeting for. What do we want to use this fund for? And what is the return? What has been the return from what we had before? And how are you going to implement what we are planning? The reason why we are not getting much of the effect is actually, this fund in Nigeria is around 5 to 7%. When even in Abuja declaration, they said that Africa should go to a minimum of 15% on health, on budgeting, the total budget for the year. There are some developed countries that are going to 22%, US sometimes goes to 28% on health, on their budget. And when we get that then, and we apply those funds appropriately, we get results. For example, we are talking about some preventive thing, immunization of our kids, of children, which will improve our infant mortality, under 5 mortality rate. We still depend on donors to give us vaccines to immunize our children. It's painful. And do you know that Nigeria has some vaccine production centers set up. One of them is in Yabade, just when we are going to Unilag, by the left. The last, I passed the first that I just look at that compound. The compound is in ruin. We stopped making vaccines in Nigeria for our own use. We have to import syringes that we're going to use. I don't understand. And we need to, empower these people. Some company can make these things for us, and then awaken and make sure we supply our own vaccine by our own money, with our own money. HIV control, for example, we should go to even the primary care level. Mozambique is not as rich as Nigeria. They are approaching eliminating mother-to-child transmission. We are copying their model for prevention of mother-to-child transmission of HIV. And they went to the primary care level to implement. They buy their own drugs. Today, the drugs, because I manage people with HIV, the drug for managing those who are resistant to the first treatment is being withdrawn by the federal government. Very soon, those who have resistance will have to buy their drug or they will die. Cuba has been declared to have stopped the transmission of HIV from mother to child. It's not the amount of money Cuba is spending. It's not anything near what the US is spending. So, accountability that Prof said, accounting for every kobo is very important. Not just budgeting huge amount of money, but the amount we are budgeting is not even enough. At the end of the day, the little amount we are budgeting take care of remuneration of health workers, and that's it. But it's just about 5%. You can imagine us making it 7%. I have about 2% more to equip and to make things nice. Like you have those quarters we are talking about, habitable for me to live. Why do I want to come and be running the traffic in Lagos when I can just wake up, go to where I want to practice, and go back to my listing and have fresh food to eat and fresh air to breathe? When you make those environments uncomfortable and then you want somebody to go there and live there, it's not possible. So all those infrastructure has to be improved. Then drugs and medicaments have to be improved upon. The pharmaceutical industry, for example, I have to bring that in here now, has been abandoned. It's cheaper for the pharmaceutical industry to import drugs into Nigeria than to manufacture because of taxation. It's like we are cutting our noses to spite our faces, and we need to do something about that.
Prof, the issue of training you talked about.